So if someone is not happy with the brightness of their teeth, I suggest that they first go to the dentist and check with the dentist to make sure that their enamel is intact. It's really important to make sure that they don't have any problems with their gums, they don't have any open cavities, because you don't want the peroxide getting down into open cavities. That can cause a lot of problems as well. And you want to make sure that your enamel isn't already worn down, because if you have very thin, translucent, worn down enamel, you're not going to get the results from whitening anyway, so you might as well not use it. But I would suggest trying an at-home procedure at first and seeing how you react to that before you go to the dentist and spend a lot of money. So there are a lot of different options for whitening over the counter. There are the strips that you see in the commercials and in the drugstores, and a lot of people use them, but there are some downsides to them because they usually only reach to the front 6 teeth. They sit on the gum tissue, so you get irritation of the gum tissue, and a lot of people complain about the sensitivity. However, they are quite effective. So you have to balance, are you gonna wanna be very sensitive? Do you wanna be super white? There are other things like one-size-fits-all trays. When you put the tray in, the gel's gonna kind of goop up all over the place, and you might end up ingesting it, swallowing it, and getting an irritated throat. There's also paint-on gels. The problem with most of the paint-on gels that you see is that as soon as your lips collapse down, the gel rinses away immediately, and then they're not very effective. The most popular in-office procedure that's been well known for many, many years is called Zoom whitening. What Zoom has is it's a high concentration of peroxide that's placed on the teeth, and that gel also has what's called a photocatalyst. The photocatalyst is what makes the light activate the peroxide and break it down into tiny little oxygen molecules, and that's what's going to go ahead and break up the stain. There are also custom trays where the dentist takes a mold of your mouth, and then those trays fit you specifically, and then you fill those trays in and wear them for about a half an hour to an hour a day, and they whiten in about a week or 2 weeks. Even if you're gonna do that expensive dental office treatment, people need to understand that there's always maintenance involved. So depending on your eating and your drinking habits and how porous your teeth are, because some people's teeth are more porous than others, you're gonna have to do something to maintain that level of whiteness. In 3 months down the road, you might have to do a touch-up with some trays or some strips or some liquid gel boosters that you'll add to your toothpaste. So everyone has to understand that it's not a one-time thing. Whitening and a white smile requires maintenance.